Hello and welcome to the Nursing Economics podcast series. This series provides extended content relating to articles published in the journal, such as interviews and roundtable discussions. In honor of Nurses Week, we are proud to present a roundtable discussion featuring key nurse leaders. This discussion, led by healthcare consultant and Nursing Economics Editorial Board member Dr. Rhonda Anderson, focuses on the founding and work of the Nurses on Boards Coalition. In addition to Dr. Anderson, participants include Ms. Laurie Benson, the Executive Director of the Nurses on Boards Coalition, Ms. Kimberly Harper, the Chief Executive Officer of the Indiana Center for Nursing, the Nursing Lead of the Indiana Action Coalition National Future of Nursing Campaign, and Chair of the Board of Directors for Nurses on Boards Coalition, and Ms. Rita Wray, Founder and Chief Executive Officer of Wray Enterprises Incorporated. The Nurses on Boards Coalition represents national and state efforts by nurses and others working to build healthier communities in America. Their mission is to improve the health of communities and the nation through the service of nurses on boards and other governing bodies. The Nurses on Boards Coalition's intent is to ensure that at least 10,000 board seats are held by nurses by 2020, as well as raise awareness that all boards will benefit from the unique perspective of nurses to achieve the goals of improved health and efficient and effective healthcare systems at the local, state, and national levels. Through today's episode, you will learn about how the coalition came to be, why it is important for nurses to serve on boards, examples of various types of boards where nurses serve, the impact of nurses on boards, and how you can get involved. We are pleased to introduce Dr. Rhonda Anderson, who will lead this important discussion.
I'm Rhonda Anderson. I'm an editorial board member for Nursing Economics, and I am so happy to be here today with you and with my three colleagues who will be sharing with us Nurses on Board Coalition information. It's an exciting time as we think about nurses on board, the contributions they make, and the other activities that occur because of their provocative questions.
It is my pleasure to welcome our guests today. Kimberly Harper, CEO of Indiana Center for Nursing and Indiana Action Coalition, who is our chair of Nurses on Board Coalition. Rita Wray, founder and CEO, Wray Enterprises. And Laurie Benson, our esteemed Executive Director of the Nurses on Board Coalition. We are so pleased that these three ladies are here today to help us as we try to help everyone understand why it is important for nurses to be on board. Kimberly, can we start with you? How did the Nurses on Board Coalition come to be?
Thank you so much, Rhonda, for inviting us to be with you today and for allowing us to share this important work that we're doing all across America to assure that nurses across our nation are improving the health across our nation through taking our voices and our experiences to boardrooms and communities all across our nation, where decisions are being made every single day that relate to health and health matters across our nation. And oftentimes that is without the nursing voice. So historically, I can share that back in the spring of 2014, in conjunction with the Institute of Medicine Report on the Future of Nursing, Susan Hassmiller and Susan Reinhardt and the Robert Wood Johnson Foundation and Center to Champion Nursing in America called a meeting in Washington, D.C. of nurse leaders of 21 national nursing organizations. At that time, they had the wonderful thought that if those 21 nursing organizations could work together on one single objective, and that single goal of being to improve the health of America and our communities through the voice and service of nurses serving on boards, what a huge difference that could make. And so throughout that year of 2014, those organizations took information back and forth from meetings in Washington to their respective boards of directors within the national nursing organizations. And within about 6 months, a strategic plan of sorts was put together and a vote was literally taken that says, are we in or are we out of this process? And at that point, in the fall of 2014, every single group that had been invited decided to join the coalition. And at that point, a national movement was begun that we have called since the Nurses on Boards Coalition. Today, the concept of nurses serving on boards is prevalent, and you hear it in every nursing leadership conversation anywhere that you attend, even outside the United States. And I can say that our members that are involved with Nurses on Board's coalition are growing. The organizations that are involved are now up to 28 nursing organizations. The Nurses on Board's coalition is strong and vibrant, and we continue to grow.
Thank you so much. Rita, how did you personally get involved with Nurses on Board's coalition?
My involvement was bifurcated. At the meeting that you heard Kimberly mention in 2014, I attended as Mississippi's Action Coalition's co-chairperson or co-lead, as well as a representative from the American Academy of Nursing. At the conclusion of the gathering of the founding organizations, it was my pleasure to accept, along with Diana Mason, the charge of co-chairperson for the Sustainability Work Group. That group at the time, its charge was to build a sustainable foundation, which included policies and procedures, bylaws, and budget. At this time, it's my pleasure to serve as the current state and national integrated strategies co-chairperson.
Thank you so much. Kimberly, how did you become involved?
Like Rita, I was invited to the very first meeting. At that point, I was the president of the National Forum of State Nursing Workforce Centers and the board of directors of that organization. I'm since a past president, but have stayed in that role with the Nurses on Board's coalition representing the National Forum of State Nursing Workforce Centers. And at the very beginning, we elected a set of co-chairs, and that set of co-chairs was myself and Marla Weston, who was at the ANA at the time, and we began to put together this organization that is now, as we said, strong, vibrant, and growing every single day.
And Laurie, why is it important for nurses to serve on boards?
Well, governance is an extension of leadership. As nurse leaders, it's both a privilege and a responsibility to serve on boards. We have the responsibility to lead change to improve health for all in our country. Board service is a powerful way for nurses to leverage their knowledge, skills, and experience to shape strategies and policies to bring about much-needed change in a way that serves patients, families, organizations, populations, and communities. It's also a way for nurses to grow professionally and personally and to give back. Many nurses report they feel they receive so much more than they give when they serve on boards, and it enables them to bring fresh perspectives and insights back into their own workplace. So it's energizing, impactful, and inspiring.
Rita, could you just elaborate a little bit more on why it's important for nurses to serve on boards?
I feel it's important because we bring and can positively impact all facets of our communities by not only bringing our healthcare experiences and expertise to the boardroom, but our well-honed leadership skills, communication skills, and negotiating skills as well.
Kimberly, would you share with us a few of the types of boards on which our nurses sit today, and potentially some of those that we might be getting to in terms of nurses sitting on in the future?
Certainly, Rhonda. There are so many different kinds of boards and appointments where nurses can serve across our country. There's certainly a place for all levels of nursing leadership, for folks who have been seasoned and in CNO roles for many years. There are also roles for the bedside nurse who's fresh out of school and ready to just get involved in his or her community. There's a place for everyone. And some of those examples would include, obviously at the big national level, we've got governmental appointments, and we've also got some organizations that would actually, pay people to serve on their boards, the big corporations at the national level. We also have hospital and healthcare boards and systems across the country. We have banks. We have governmental appointments. We have the governmental task forces. For example, a governor's task force may be appointed in a state for certain things and appoint a nurse to that. Community organizations of all kinds, PTAs, school boards, neighborhood associations, places of faith, youth sports leagues, homeless shelters, pet shelters. I could go on and on. If you think about any activity within a community at the local, state, or even national level, it's hard to really realize that any organization and any board has absolutely nothing to do with healthcare, because I don't really believe that's true. I think healthcare is related to everything that we do. So as we move into the future and look at newer opportunities for places for nurses to serve, I certainly hope that they will become more involved, at the governmental level, that we'll have more nurses running for legislative positions, across our country. That's certainly a wish by many of us. But also at the local level, we can get the staff nurse on the youth soccer league of their his or her child's school and make a huge difference in what happens with healthcare at the local level. So lots of opportunities, and truly there is something for everyone.
Thank you so much. Laurie, that leads us into what impact do our nurses make on boards today, always centering around how we can influence the health and well-being of our communities. What other impacts are there that our nurses are making?
Well, first of all, based on the diverse types of boards that Kimberly has just described as opportunities for nurses to serve, the impact of nurses on boards certainly starts with getting the right nurse on the right board for the right reasons in order to have the greatest impact, and making sure nurses serve on a board that aligns with their passion. So nurses serving on boards and contributing to the collective impact of the board of a whole is really difficult to measure on an individual basis because of that board dynamic being a collective impact. So nurses often contribute in the role of change agents, leading change to bring about the best possible outcomes in support of the mission of the organization. Nurses are uniquely and ideally suited to influence the board discussions and outcomes by exhibiting exceptional ability to listen, critical thinking skills, utilizing evidence-based approaches, and by asking key questions that often result in new thinking, discussions, and outcomes. And one of the strategic imperatives of the Nurses on Boards Coalition is to measure the impact of nurses on boards. So we started out by asking nurses to share their stories about why they serve and the impact they are having. And I'm happy to say that we have over 200 of those posted on our website for our listeners to look at and see the variety of ways that nurses are having an impact on boards. The Nurses on Boards Coalition is currently in final preparations to conduct an initial qualitative research study to begin to measure more precisely the impact of nurses on boards. And we are committed to conducting additional research in the future so that we can more clearly demonstrate and articulate the value and impact of nurses serving on all types of boards.
Thank you so much, Laurie. Kimberly, as we close this podcast, would you please share with us how nurses can get involved and what the call to action really is?
Absolutely, Rhonda. As we wrap up this podcast, again, we want to thank you and to Nursing Economics for this wonderful opportunity. And we want to everyone listening to us today to be thanked for your leadership. Thank every one of you for everything that you're doing, whether it's in the boardroom or not yet, across America. As far as the call to action, we would love to call everyone to action. You know, it's important that each one of us step up and serve. We have a Nurses on Boards Coalition website, and we would encourage everyone, as Laurie said, share your story with us on the Nurses on Boards Coalition website. It's nursesonboardscoalition.org, and we want everybody to log on to that website, look it over, read the resources, see what's available in there, and tell us if you serve or if you wish to serve. It's important to us to be able to keep track of how many nurses out there are serving on boards. And so we actually have the ability to have collected information about nurses serving on boards. And we have many, many, many thousands of nurses that are serving on boards today. But we want you to tell us about your service. So if you're listening today, please log on to our website and get involved with us. Tell us if you serve, or if you don't serve yet but would like to serve, tell us that so we can be in contact with you to help you find the right place that you can step up and be involved. Let us know how we can help you, because that's what we're here for. We have many, many resources available to share for all of you to help you get to the right board at the right time. We also would love for you to share what you've heard today with your colleagues and encourage them to submit their service to the Nurses on Boards Coalition database and step up and be counted as well. It's important to all of us. I think the healthcare of America is counting on us, and we as nurses and nurse leaders across America need to get involved with this work. We need to get the nursing voice to those tables where the decisions are being made each and every day across our country.
Thank you so much, Kimberly, and thank you to Rita and Laurie also. Wonderful comments for our audience. I really appreciate you three as our colleagues and supporting the work that we want to be doing in the Nursing Economic column on Nurses on Boards. We're looking forward to your publications in the future. I also just want to say how important it is to understand this is about the health of America. This is not just about trying to get a nurse on a board. Nurses are the most trusted profession in our country, and as we think about that, what better place for them to influence is on a board of their passion, and a board that needs this type of input for the decisions that they make in the future. Thank you, colleagues, for your wonderful work.
The Nursing Economics podcast series is owned and produced by Genetti Publications, Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Ms. Kimberly Harper is the Chief Executive Officer of the Indiana Center for Nursing, the nursing lead of the Indiana Action Coalition National Future of Nursing campaign, and chair of the Board of Directors for Nurses on Boards Coalition. Ms. Laurie Benson is the Executive Director of the Nurses on Boards Coalition. Ms. Rita Wray is founder and Chief Executive Officer of Wray Enterprises, Incorporated. Dr. Rhonda Anderson is a former executive with Banner Health, including Chief Executive Officer of Cardin Children's Medical Center in Mesa, Arizona. She is currently a healthcare consultant for RMA Consulting and serves on numerous boards, including the Nursing Economics Editorial Board. For more information about the Nurses on Boards Coalition, visit the Coalition's website at nursesonboardscoalition.org. and look for the Nurses on Boards column in the Nursing Economics Journal. For archived episodes of this podcast and to learn more about nursing economics, visit the journal's website at nursingeconomics.net. You can also subscribe to the Nursing Economics podcast on iTunes, Google Play Music, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and other various podcast delivery services. And as a listener, you can save 50% off your first year subscription to Nursing Economics. Simply visit nursingeconomics.net/offer to take advantage of this special discount.